Okay, this video is part 4 of 4 parts about how to prevent a seizure, reduce the risk of epilepsy, and it's really also how to reduce the risk of excitotoxicity, the loss of brain cells that leads to cognitive decline. This picture here, I've shown it a bunch of times. It's sort of like you might want to print screen on it if you haven't done so. We're already on part 4. This is the last of the parts here. I'm going to go through some more papers on what causes seizures and excitotoxicity. So one thing I thought was a little bit interesting is that diabetic patients have increased risk of seizures. About 25% of diabetics will at some time have a seizure. That's higher than I expected. It sounds a little exaggerated, but that's the numbers they came up with in this paper written by a couple of Chinese guys. But it's in a pretty mainstream diabetes journal, Current Diabetes Review. So anyways, anti-diabetic drugs were considered the most effective way. And you can see why this is a bit of a problem and surprised me, because if 25% of diabetics have a seizure at one time or another, it's especially worse if they have more serious disease. And why do they have it? Well, they can have microvascular lesions from diabetic microvasculopathy, local brain damage, metabolic factors can do it, diabetic ketoacidosis, hypoglycemia. So they could have a seizure. It could be an isolated event due to hypoglycemia, overtreating themselves. Nowadays with continuous glucose monitors, they'll find they often overtreat themselves and are hypoglycemic at night once they get a readout on their continuous glucose monitor. But it's still kind of interesting because a lot of people recommend, for refractory epilepsy, these high-fat keto diets, paleo-keto diets. But those same patients that causes insulin resistance, they're at increased risk for diabetes. So then they're going to be potentially treating themselves with diabetic medications and, potentially running into trouble. Okay, here's aspartame. We talked about aspartame as that's, artificial sweetener, NutraSweet, and that's associated with increased risk of a seizure. Aspartame also potentiates the induction of seizures by inhaled this and that. In mice, if they're given aspartame, it'll also increase plasma phenylalanine. There's competition for entry into the brain with the amino acid transporters, and so when you get a bolus of one amino acid, it can kind of overwhelm the other amino acids that compete for that transporter. Aspartate is an excitatory amino acid that can activate the NMDA receptor for glutamate, allowing calcium. It's a calcium channel into the cell. We talked about glyphosate. Here's a paper on glyphosate infiltrates the brain and increases pro-inflammatory cytokines like tumor necrosis factor alpha. And that's a very powerful inflammatory chemical. It's associated with also increased beta amyloid protein. That's the so-called Alzheimer-related amyloidogenic protein. That can form oligomers, bind with itself, and then have a mass effect on the plasma membrane. Can have an effect on the NMDA receptor too to let in more calcium. Can be an cytotoxicity effect. Okay, so GP is something you want to avoid. We talked about how high-fat diets with lack of fiber can cause leaky gut. Other things can cause leaky gut too, like NSAIDs, for example. But when you've got leaky gut, you'll have an increased risk of postprandial endotoxemia, meaning these are endotoxins of bacteria, lipopolysaccharide, lipoteichoic acid. There's often a leaky blood-brain barrier when there's leaky gut barrier, and they have increased access to the brain. They can activate your microglia. Microglia can release chemicals to sterilize what it presumes is a bacterial infection. Those sterilization chemicals cause brain inflammation, potentially loss of brain neurons. Increased inflammation can cause increased activation of a neuron. So anyways, this is one of the mechanisms of a potential neuroinflammation, and I would worry about that in a seizure patient. This is just kind of going back to the typical action potential. I had that extra slide in there. Okay, what are some other papers? Excessive sodium chloride activates the sympathetic nervous system a little bit. So then you run into the whole increased cortisol, catecholamine, Acute increases in plasma and cerebrospinal fluid sodium concentration activates SANS, so you're going to get increased sympathetic autonomic nervous system. That's going to cause increased glutamate. It could have a mild excitotoxic effect. It'd have to be pretty mild because usually sodium doesn't cause that much trouble. I had just made this mnemonic for my neurodegeneration theory. This is sort of a shortened down mnemonic. Rosie, Rogers theory. Oxygen glucose delivery decrease. That means you'll have hypoxia, hypoglycemia, and that can have an excitotoxic effect on neurons. Stimulants can increase the likelihood of that. We talked about how really mild sodium, excessive sodium is a really mild stimulant. MSG and MFG have a stimulant effect. Excessive psychological stress does. Caffeine does. Sleep deprivation does. Aspartame does, glyphosate does, beta amyloid protein due to high-fat diets where you get increased insulin in the blood, then you clear it all out with the insulin-degrading enzyme, but there's not enough left over to clear out all the beta amyloid, so it goes back into the brain from the periphery, and that can cause increased excitability of the NMDA receptor, thus having a stimulant-like effect, increasing the amount of calcium going into the cytoplasm. Inhibitors of mitochondria and circa, because then you can't make ATP when you inhibit the mitochondria, and so then you can't pump the calcium out of the cytoplasm. You get an excitotoxic effect. Circa inhibitors, sarcoplasm, endoplasmic reticulum, calcium ATPase to pump calcium from the cell cytoplasm of the neuron into the endoplasmic reticulum, the calcium storage site, and if you can't pump it in there, you'll get calcium accumulation in the cytoplasm with potential excitotoxic effect. So, not good, potentially going to increase the risk of seizures. And I just said with my theory, this is the supply and demand theory of dementia, also called the neurovascular uncoupling theory of dementia, is if you increase MR, metabolic rate of a neuron, but don't simultaneously increase the oxygen glucose delivery. I jokingly call it GOD for glucose oxygen delivery. It's usually abbreviated OGD for obvious reasons. And also mitochondrial production of energy is necessary and relevant to this and circa function. So anyways, then you can end up with a big gap between the metabolic rate and the glucose oxygen delivery or ATP production, and that can cause a neuron to die. But before it dies, it can become excitotoxic, and potentially I would worry about that precipitating a seizure. One last calcium channel I hadn't referred to earlier was the TRPV1, which is a vanilloid calcium channel, and that's the one that can be activated by heat, by capsation, like from pain. But alcohol can activate this as well. So can volatile organic chemicals, VOC. So can EMF and Wi-Fi. So you'd be better off probably having your computer hardwired in your house than having Wi-Fi. You'd be better off using your speakerphone than holding your cell phone to your head, because that can open up, voltage-gated calcium channels and this TRPV1 vanilloid channel. So in somebody who's sensitive, that could potentially be a significant thing. Okay, here's just some papers to that effect. Smart devices, mobile phone in patients with epilepsy. Let's see, among animals, 10 articles suggested detrimental effects by electromagnetic fields on brain function and seizure activity. Among humans, 7 studies suggested detrimental effects from EMFs on brain function and seizure activity, but 7 said the opposite. So whenever you hear all of a sudden 7 studies said the opposite, I always worry about industry funding. So when the industry senses that something's bad for their product, they can just buy the journal. These got billions of dollars, these companies, and then buy a couple scientists and produce articles saying, well, the balance of the article says the opposite, so nobody knows. I would believe usually when something criticizes a commercial product, it's so hard to get that published, that's more likely to be true. The next one is in one human study, all 7 patients with epilepsy and abnormal EEG had increased epileptic events with exposure to mobile phone radiation. In school students, it was found that for reporting seizures, and it was proportional to the amount of cell phone use. So it probably is real, would be my impression from reading that little back and forth there. And this one says Wi-Fi opens up TRPV1 calcium channels. We know EMF opens voltage-gated calcium channels. So you're letting more calcium into the cell, which you'd expect to have an excitotoxic effect, potentially apoptotic effect, cell death, but also potentially with the excitotoxicity effect, potentially increased risk of seizure. So, like I said, I think it would be wise to minimize that if you could. Here's another paper showing where the cell phone is placed over tissue culture with both astrocytes and with neurons, that the neurons were more sensitive than the astrocytes, but both were sensitive. So here's a cell phone over the astrocytes and neurons in a tissue culture, and they both started expressing more pro-apoptotic cell death chemicals. So that's kind of interesting. It's a reminder to minimize exposure to this stuff. So anyways, that's the end. That's 4 of 4 lectures on how one can reduce the risk of seizures in patients with epilepsy. And so sort of like, what did I contribute there? Well, there was the basic standard recommendations given by neurologists. Get your sleep, don't be sleep deprived, try not to be stressed out, avoid alcohol, take your medicines, okay? And I think I went a lot farther than that by showing all these other things that essentially are like being stressed out or like being sleep deprived, and also that opened up voltage-gated calcium channels, TRPV1 calcium channels, etc. And those things are likely to cause excitotoxicity. Things that cause excitotoxicity increase the risk of a seizure. So it just added a whole bunch of things, like avoiding, antidepressants that could potentially be beneficial, depending on the context, of course. So anyways, I hope that was helpful.